Hello, I'm Irvine Mayor Christina Shea, and here with me today is Dr. Bernadette Boden-Albala, Director and Founding Dean of the Program in Public Health at UCI Health. We are here to discuss a number of important topics and to provide a community-wide update with what has been taking place in Irvine over the last few weeks. On Monday, July 13th, the City of Irvine launched our COVID-19 drive-up testing program for individuals who live or work in the City of Irvine. This no-cost PCR testing program is available to those that are symptomatic or asymptomatic. I was able to go out to the Great Park on the first day and participate in the program. It was an easy and efficient process, and I'm very proud that Irvine is the first city in Orange County to provide COVID-19 testing to the public. Testing continues to be a critical component for reopening under state guidance, and there has been great interest in our testing program. We're looking to expand our capacity to provide additional appointments, and we will update you when those are available. Also on Monday, July 13th, we launched our rental assistance program that provides residents the opportunity to apply for a one-time $1,000 grant for either rental payment assistance or lease termination fees. This program is open now through July 24th till 5 p.m. Upon closure of the application period, a lottery system will be used to select grant recipients. And for more information about the program eligibility and to apply, please visit the website below. Throughout this COVID-19 pandemic, we have been working to provide additional support and solutions for Irvine businesses, which also includes awarding 506 businesses impacted by COVID-19 with a one-time $10,000 grant through our Small Business Grant Program. The City Council recently approved a program to allow restaurants to expand their outdoor seating capacity. Since then, the City of Irvine has worked diligently with our community partners and restaurants to permit 19 areas for expanded patios at 24 shopping centers. With Governor Newsom's closure of indoor businesses and operations, allowing restaurants and retail to expand their capacity outdoor is so critical to help our local businesses while ensuring the health and the safety of our community. The topic of reopening continues to be at the forefront for everyone. The city continues to implement and follow guidance from the state of California. We were pleased to reopen pools in June and a number of other amenities, including offering summer camp programming. These summer activities offer much-needed summer recreation and keep families and individuals safe as we continue to follow the latest guidance from the state and the county. New programming is available every Monday at yourirvine.org. Now, I would like to welcome Dr. Bernadette Boden-Albala to provide an update about COVID-19 for us. Doctor?
Good afternoon, and thank you very, very much for inviting me back. I'm sorry that I'm here under continuing stressful circumstances. Today, I want to spend a little bit of time talking about COVID-19 here in Orange County, here in Irvine, and I really want to talk through where we are. And so we're going to start with this slide, and you may, if you've seen me before here, have seen this slide because I had it up. And this slide, in my opinion, represents hope because it represents what we can do. So let's go all the way back to March when we were just at the beginning of this and really not knowing what was going to happen with COVID. And if you remember that we were in a really bad place, we were doubling every 3 days. And if you look at these two figures, the figure on your left with the little arrow that says March 28th, and it has that kind of exponential line going straight up, that was what was predicted to happen, that we were going to just increase the number of COVID cases. We were then predicted to hit this peak, this surge. But instead, on around March 12th, 13th, 14th, UCI and the county and the governor of California all said we're going to shelter in place and we're going to halt transmission so that when people get sick with COVID, that we have enough beds, we have enough ICU, ventilators, and that we decrease the poor prognosis of people with COVID. And we did it. If you go to the figure on your right, what you find is that instead of us going and constantly increasing cases of COVID, you find that we actually did flatten the curve. And so that means we can do it. So here we are in Orange County now, and we start to see this increase of cases, and we are really increasing now again on that exponential line. If you look at the number, figure B looks at new ER visits and hospitalizations, and again, you see that there was this diminished time and then up, up, up. And I'm very concerned about this. We are increasing the number of cases that we're seeing, and that the rate of people getting tested who are positive has gone from about 4%, that's what we were seeing in March and April, to almost 8% now. So COVID is spreading. And we know here that COVID has revealed itself in Orange County, like in New York and other places around the country, as a disease of disparities. It is hitting our Latinx populations disproportionately, both in terms of case diagnosis as well as poor prognosis and death. If you look at white and Asian communities, which are also there represented in figure C, that they are also rising now and rising more than they were before at an alarming rate. What I want to show now, I'm going to go to the next slide. I want you to look carefully, and we're going to put this on, and this is the growth. This is a heat density, and just start looking at the shadows. Now we're in April, and we're seeing some shadows emerging. These represent the number of cases by census tract in our county, and you can see that there's this spread, both southern and northern counties, a lot of spread in Anaheim and Garden Grove and Santa Ana, in Orange, spreading out to Tustin. We're here now in July, and you can see this huge area of COVID-positive cases in the sort of northern part of the county, but it really has spread to all areas of the county, even southern county, and down to coastal areas by the Pacific. So in March and in April, there were less cases, and the cases were not spread as diffusely around county. And now what we're seeing is that there really is a major transmission and spread throughout all of the county. And what that means is that we have to continue to be vigilant. Vigilance with a mask, vigilance with hand washing, social distancing, and keeping the number of people that are around you really to the people in your pod, in your household. So I really just want to spend the last few minutes talking about what I call the anatomy of an epidemic. And, you know, this is something that infectious disease epidemiologists really dread, and that is when an infectious disease like a COVID or other infectious diseases, first we start out and we're in acute, and we were thinking about we want to be prepared, right? Remember, preparedness was, again, washing our hands and social distancing and prevention. I'm going to shelter in place. I don't want to get this. We were all in crisis mode, and we were willing to do anything we needed to stop that transmission. But I just want to talk a little bit about where we are now so you understand. We are fatigued. There isn't any of us that haven't felt like they've hit a wall multiple times, staying in their home, trying to be vigilant. We've got kids, we've got elders, we've had huge economic hits. We've had the beauty parlors closed, we've had them open, we've now closed them again. This is daily and ongoing challenges, and I understand, we all understand. We just have to try to stay the course. Depression, anger, frustration. There are resources to help, but this is really what we're going through. We need interventions. We're working with government agencies to try to do this, to try to keep ourselves protected, but try to move out. We're really working on something called harm reduction. So we want to try to do everything we can do to keep the virus down, to prevent transmission. But it means doing the same things we did so well in March, even though it's 16 weeks later now, and these things seem tougher and tougher. So just hang in there, and hopefully the next time I'm invited back, we'll have really good news for you again. Thank you.
Thank you, Dr. Boden-Albala. I also want to thank each and every one of you for doing your part to keep our community healthy by washing your hands, wearing a mask in public spaces, social distancing, and staying home if you don't feel well. Together, we can keep our community healthy and protect one another from COVID-19. I'm Mayor Christina Shea, and thank you so much for watching.